supplements that can actually help with this and help, a young man or older man to overcome this condition. So we advise men when they're doing this to talk to, someone that they can trust, a doctor or some medical personnel who they know can talk and give them the right thing. Men shouldn't be going to a friend or somebody who's not trained properly to speak to them about these things, because you have some men taking the blue pill. Actually, when they take them, they're dead on arrival as well, or dead in a bed. Okay, because their heart could not take it. And a lot of men do not go to their physicians or have their annual physicals for these things. When you take things like Viagra or things to actually help with erectile dysfunction or impotence, it's something that should be controlled by a medical physician or somebody medical, unless it's a natural supplement. All right. But if it's something like Viagra, you don't need to be taking that out the back door, young man. Okay. Now, so talk to somebody who is trained in that area to find out the underlying conditions and what you need to do to treat erectile dysfunction. All right. Now, most of the conditions that affect erectile dysfunction stems from circulation. Okay. So it is not uncommon for obese men to experience erectile dysfunction. Studies show that obese men are more than twice as likely to experience erectile dysfunction than those who are not overweight. Obesity raises the risk of cardiovascular conditions, including arterial cirrhosis, which is hardening, of the arteries, built up of fats in the artery, and all plaque in the artery wall that limits the flow even to the penis. As I said, circulation. Also, men who are obese often have an imbalance in hormones and hormone levels. So, we always like to say, women always having hormone imbalance, but men do have it. Alert, alert, alert. Men also have hormone imbalances. All right. But let me just stick a pin in there just for a quick moment. Ladies and gents on the line, if you have a child, a male, and you see that his testicles are not coming out, or his penis is not growing to his age rate, you should carry that child to his pediatrician, who would refer that child to a urologist, because we have too many men passing the stage of puberty and going into adulthood where their genitals have not grown properly. And this could have been corrected if it had been caught before or in the adolescent stage, so that his penis could be at the stage of life that he is in adulthood. All right. So let me just stick a pin in there. If you see your son or your daughter or your nephew, I'm sorry, not your daughter. We're talking about men now. Do apologize. If you see your son or your nephew or your little brother or whatever, your grandchild, whereas their genitals look like they're not growing, something is wrong. They need to be sent to the pediatrician. Don't let that child grow into a man and have this problem that now he's trying to correct, and it's hard to correct because he is past the adolescent stage. All right, just wanted to put that, stick that in there. Okay, because many persons do not know that sometimes when you see that happening, there's an imbalance of hormones in that child that can be dealt with. Okay, so let me just give you a short story. My first son, he had a caretaker, and his caretaker's son, when she looked at my son, who was 2, his genital parts was bigger than her son, who was already 11. Something was wrong. And I told her something is wrong. I actually made an appointment for the child with the urologist. And after I did that, that mother came and shook my hand because her child genitals started to grow in the age. So see, all this can cause impotency, and it could cause actually erectile dysfunction when this child goes into a man. So we have to take note of that even in our young males. Just wanted to stick a pin in there, and now I'm going to remove the pin so that y'all could get that information, okay? Studies show that obese men have lower testosterone levels than men of average weight. Testosterone is a necessary element in achieving and maintaining an erection, okay? And I just finished talking about hormones, okay? Not only does obesity influence a man's physical ability to keep an erection, but it affects him physically as well. Obese men are more likely to experience decreased libido. They don't feel like doing nothing because they have a lack of testosterone, okay? So it lowers their libido. It causes depression and decreased energy, all factors which can cause erectile dysfunction. So putting on weight affects a man's sexual life, all right? Some men say, oh, I just got a bare belly, but bears and rum have high calorie intake. So that's the problem with drinking alcohol beverages, okay? It has a very high caloric intake, which causes a man's stomach to be enlarged, okay? Diabetes. Up to 75% of men with diabetes will experience erectile dysfunction at some point in their lives. According to the Mayo Clinic, poor long-term blood sugar control may cause damage to the nerves and blood vessels, so leading to ED. So when, if a man finds out that, hey, he is pre-diabetic, before even having to be put on oral or insulin injections, he should try and control this by diet. All right. As I tell people, the human body is it can be likened to a vehicle. Our vehicles give us signals and signs when something is about to go wrong. Like, for instance, I drive a BMW. With my BMW, I love the Europeans and how they make their car. If something is about to go wrong, the light on my dashboard would be orange. When it's in the danger zone, it turns red. So this happens in the human body as well. We have little signals, but we sometimes ignore these signals until that light comes on. The light stop blinking, the yellow light stop blinking, coming off and on. Hey, we have a little problem coming on. Hey, we have a little problem coming on, until that light strikes red, and then we have a big issue. And that's when we decide to become serious. But when we become serious, when that light turns red, it's harder to actually control the issue, okay? So please pay attention to those signals that in your body when something is going wrong, all right? So according to the Mayo Clinic, let me repeat this, the Mayo Clinic, poor long-term blood sugar control, not controlling your sugar, can cause damage to nerves. So you call it diabetic neuropathy, all right? And blood vessels, leading to erectile dysfunction. So it lacks circulation. This is why men with diabetes will experience erectile dysfunction up to 15 years earlier than men without diabetes. Usually, the average man around 65, 70 starts to have issues. If he's a healthy man, 65, 70, he starts to have, problems with erectile dysfunction. So if you take away 15 years from 65, that's 50, that's a young man. Oh my God, a young man. And usually men who are in their 50s, their wives are like mid-40s. And a woman, when she meets mid-40s, let me get real for y'all. She froggy, she ready to jump anytime. She's at the height, she's at the peak of a sexual life. And he cannot deal with his partner. That's an issue. Okay? So let me go on. In addition, diabetes is often linked with other medical conditions that can cause ED, including high blood pressure. Diabetes and blood pressure and coronary artery disease, for some reason they like to hold hands. So if you start off with diabetes, please take control of your life, because guess what? Hypertension is coming next. Then take extra control, because guess what? Arterial disease or artery disease is going to come next. And then after that, coronary artery disease. And you know what likes to join hand with all of these? Kidney failure. So this is why we have to pay attention to that yellow light, ding, ding, something is going wrong. Some medications may help a man with diabetes achieve and maintain an erection, although many of them are not suited for people with heart conditions. You remember when I said before, a lot of men go and take the little blue pill or these other things, and what happens is the fact that their heart cannot deal with it, and they do not know, because on the average, only about 20% of the males really do an annual, okay? And that's when they are, their spouse or their loved one or work actually pressures them to take it, all right? So let me go on. Although many of them are not suited for people with heart conditions because they interfere with heart medication, and some of heart conditions don't even know, so they're not even on heart medication. So that's another ball game, all right? High blood pressure. And I just finished talking about diabetes and coronary artery disease, high blood pressure. They are friends in a body, man. And guess what? When those three friends hook up, guess what? What happens is kidney failure decides to join the gang, And so this is why, as I said before, when that yellow light on the dashboard starts to blink, pay attention. It's a signal that something is going on in the body, all right? Not erectile dysfunction is hypertension or high blood pressure. Chronic high blood pressure is when the heart is working too hard to pump blood, and the blood is repeatedly putting pressure on the walls of the arteries. According to the Heart Association, 1 in every 3 adults, listen to this now, 1 in every 3 adults over the age of 20 have high blood pressure. My Lord. So some of you on this line, when last of you took your blood pressure? What do you know? How do you know your heart is functioning properly? And this says over the age of 20. Some people believe, oh man, I in my prime, so nothing is going on with me. Okay, so Lord have mercy. Where was I? Hypertension raises the risk of heart attack, stroke, heart failure. There it goes, kidney disease, as I said, or failure, vision loss, angina, peripheral artery disease, and sexual dysfunction. In men, it can present as erectile dysfunction. In women, it may present as low libido. To manage high blood pressure, the American Heart Association recommends eating a balanced diet that is low in salt and sodium, limiting our alcohol intake, being physically active, maintaining a healthy weight, and properly taking any prescribed medications. These are something that I mentioned be, in the first segment of this talk. Let's go on. High cholesterol for all our steak and lobster and shrimp people on this line, and things high in saturated fats. Yeah, boy, they taste good, but boy, look what they can do, to the artery wall. This right here, this yellow stuff, is not supposed to be here. It's not supposed to be here. And if we were to, as they said, with high blood pressure, this is what happens. And so if we were to examine some of us right now on this line, and there are 9 persons on this line, I think probably one of us may get away with it. I'm serious, because I can teach about this because I'm a nurse, and also, as they say, nurses, doctors, medical persons make the worst patient. I too had an issue with this. I too. But at the end of this call, we do have some solutions where persons on this line also had some, solutions to this. And I wish persons who did not know about this was on the line. And I know we may have 1 or 2 persons who don't know about it on the line tonight, okay? One of the most common causes, but I know Dr. Ruth Ann, you're putting this on Facebook and on YouTube, right?
We on YouTube, yes, ma'am.
All right, good. So
yeah, and Facebook, yes, ma'am.
You can look at, so guys, you can look for this talk on Facebook or YouTube and send it out to persons so that we can, you could save a life, okay? Or you could save, somebody who's having this issue, because men, they suffer in silence. Some of them don't even tell their spouse about what's going on. Okay, let me get on because I have a call that I have to go on. But I just, as you see, I have a passion for this. Okay, I have a passion to help people with their health. One of the most common causes of erectile dysfunction is atherosclerosis, and we talked about this earlier. Atherosclerosis, a hardening of the blood vessels with fatty tissue and plaque. All that is fat, man. Fat. Closing artery walls, causing pressure. All right. So the high cholesterol can lead to this condition. Research shows that men with high levels of total cholesterol have an increased risk of developing erectile dysfunction. Men, stay away from all those high saturated fats. I know you like your steak. I know you like your pork chops. I know you like your baby back ribs. I know you like your your stuff that are high in cholesterol. I know you like your crawfish or your lobster and your shrimp and your cow. But come on, guys. Now, I spoke to a gentleman the other day and I asked him, I said, okay, you have 2 cakes. One is on your plate. The other is in your bed. Your food is 1 cake and your lady is another cake. Which one are you going to sacrifice? Which one are you willing to sacrifice? He said, boy, look here. I ain't sacrificing the one over there in my bed. What are you willing to sacrifice? The one on your plate or the one in your bed? Okay, so furthermore, studies show that erectile dysfunction in patients with high cholesterol is indicative of and puts the person at higher risk of later developing coronary heart disease. Okay, so let's move on. Man on his heart right now probably had too much steak. It is proven that erectile dysfunction may be an early sign of heart disease. There are a number of reasons these conditions are related. Firstly, the buildup of plaque, as I talk about fats in the arteries. I keep on repeating these things, can limit blood flow to the penis, leading to difficulty with an erection. Another reason, according to the Mayo Clinic, is due to dysfunction of the inner lining of the blood vessels and smooth muscles. This limits blood supply to the penis and the heart, causing first ED and then heart disease. Men, if you're having erectile dysfunction, you not only check that, you have to check your heart, because sometimes, most times, erectile dysfunction is a warning sign. Remember, I talked about those lights on the dashboard. It's a warning sign that something is going on with your heart, okay? Smoking damages blood vessels, which results in poor circulation and poor blood supply to all the organs in the body, including to the penis and to the heart. The chemicals from cigarette smoke line the blood vessels and impair their function. If the blood vessels in the penis are damaged, they cannot expand and fill with blood, which is necessary for an erection. Fortunately, if you quit smoking, your vascular health is likely to improve. Okay? Alcohol, I just finished talking about alcohol earlier. Alcohol acts as a depressant on the nervous system. It can block message from the brain to the body, affecting a man's ability to maintain an erection. And, I've had some couples and, counseling them, and, some of the men say, man, look, I even try and take some Guinness or something or some gin to do. And, sometimes the women say, yeah, but you just fall asleep. It's a depressant of the nervous system. So you think you're doing good, all the while the woman wake looking at you because you want to drink some alcohol and depress your nervous system and you sleeping. You fall asleep on the woman. Come on, man. Stop that, okay? We have something here to keep you up, okay? Keep you up and keep you up, all right? Keep you in two ups. An eye open and guess what? The other thing up, all right? It can block messages from the brain to the body, affecting the man's ability to maintain an erection. Short term, alcohol may prevent the blood vessels in the penis from closing, okay? Once they are filled with blood. This means that a man may be able to become erect, but not to maintain the thing, man. Sorry for that Bahamian slang, maintain the thing, man, all right? Not be able to keep up, all right? You get there, you strong. And then one or two stroke, it's gone. So you gotta stay away from the alcohol. That ain't working, all right? Long-term alcohol can cause damage to blood vessels and lead to hypertension and heart disease. Two big risk factors for erectile dysfunction, okay? Here we go. Degenerative diseases, all right? Degenerative diseases are conditions in which there is a continuous degeneration of the cells in the tissues and the organs. Various studies found that 50 to 75% of men with multiple sclerosis experience ED. Women with MS also experience sexual dysfunction in the form of low libido. Other degenerative diseases which may also cause erectile dysfunction include cystic fibrosis, which can be dealt with, Parkinson's disease. They're working on that, but we have something here that can assist, but it can assist, but we're not saying that we heal or cure anything, okay? Huntington's disease and others, okay? We had somebody before, at least two persons who had MS, and one lady who had called and she didn't even want to be intimate with her husband anymore because of MS. And he wanted her to try, but she failed to try because it became a mental thing as well. And so she went on the products. And guess what? I can say that her and her husband are happy campers, okay? Now, prescription and over-the-counter medications, another culprit. Unfortunately, there are many prescriptions and over-the-counter medications, big pharma, that can cause sexual dysfunction. These drugs include diuretics, high blood pressure drugs, antidepressants. I hope you're writing these down. Anti-anxiety, anti-epileptic drugs, antihistamines, non-steroidal anti-inflammatory drugs, Parkinson's disease medication, anti-arrhythmics, muscle relaxants, prostate cancer medications, chemotherapy drugs. If you're experiencing ET due to drugs, do not stop taking your medication. Talk to your doctor to see if there is anything you can do, i.e. switching drugs, reducing the dose, or being here on this call, because we're going to tell you what can assist in this to improve the situation. See, when we go to our physician, men, ladies, you are, see, sometimes we just go and the doctor say, okay, I'm writing this and you must take this one time a day and this amount and whatever. But how many times say, okay, doc, I hear you. Be real. What are the side effects of these medications that I'm putting in my body? What are the side effects? Sometimes we take a medication for something, but it can cause something else to go wrong. Always remember that. So when you're next time you go to your doctor visit, if you're on medication, doc, what are the side effects? And then another thing doctors do not do, if you're on medication for a long period of time, they're supposed to do drug toxicity testing on you. If you're on medication for a long time, they're supposed to take the level of the medication in your blood to find out if it is too much and if they have to reduce it or if they have to change the drug. Oh, okay. Y'all better learn some stuff tonight. Okay. Depression, anxiety, stress. Physical and medical problems are not the only cause of erectile dysfunction. If a man has low libido or suffers from mental health conditions, he may not be able to achieve or maintain an erection. This includes depression, anxiety, or stress, but it can also extend to relationship problems and intimacy issues. Men, talk to a mental health professional to figure out, or a counselor, somebody, reach out to somebody to figure out the best course of treatment so that you can enjoy time in the bedroom with your partner. A lot of men are stressed out because men are our leaders. Men carry a lot on their shoulder. And then, I had some woman hit me up, like, yeah, I just carry a lot on my shoulder as a woman too, but guess what, this a man's call, this a man call. We have our female call. And we do have our female call by Dr. Joy Piera, who comes on and she speaks about men. She speaks about women and their health. Okay, but we're talking about the males tonight. And, women, when we're stressed out, most of us, we complain. We're verbal creatures. Even when we're not verbal, our partner knows when we're stressed out or something is wrong with us, because guess what? We act the part. We let them know, guess what? We are not on this run. We let them know that something is wrong by our body or by our mouth, the way how we act. Some women, I saw a man, he said, look here, I stopped trying. I said, why you stop trying? He said, that woman, man, look here, when she walk around the house, she walk off with her mouth long off. She slammed the cupboard door. She so she put in the yard. When she come with the yard, when she come with the car, slam the car door, blam, come in the house, blam. Why did it? Even if the man was trying to do something, he didn't want to do nothing no more. He didn't want to do nothing no more. So all those things causes erectile dysfunction, because guess what? The man is now conditioned his mind and his body that, guess what? This woman don't want me bothered with her. I just ain't gonna do nothing. And so when he tries to, sometimes he may get an erection, but it's not gonna stay up. It's not going to stay up because he don't know what this woman wants. And women, men are not, we do this sometimes to our men because they don't have a crystal ball. But we expect when they say something, yes, men do say some things, and do some things. But if we don't say, hey, what you did, I did not like, how will they know? They're not fortune tellers. And for some reason, we as women, we love them to be fortune tellers by the way how we act around them. I'm mad with him. I ain't saying nothing to him. And the man looking at you like, well, why is she some what happened? And he didn't know. He didn't even know that what he said upset you. So we cause a lot of depression, anxiety, and stress in these men. And men, when your lady does that, wait until she calms down and you say, baby, you were slamming the door doing this. Did I do something to offend you? But you gotta wait until she calms down. When she in that high speed, don't bother with her because she got blurred out some things, but she ain't supposed to blurt out. We as women, we need to learn how to control our emotions, and most of us have not. And so when we do this, we can cause our men to actually turn away from us. We could cause our men to stop feeling for us. We could give our men, as I said, depression, anxiety, and stress, that they ain't really into that no more. You touch them and that ain't really coming up. So be careful of your actions if you're on this line, if you're married or have somebody that you're intimate with or whatever. Be careful, females, how we act towards our males, the same way how we want them to treat us. We must treat them as well because they have feelings just like us. So with that said, I thank you for coming on, and I'm gonna now turn this to Dr. Ruth Ann, or I don't know if she wants me to actually speak about the product. No, she speaks of that product very well, about what can assist us and assist. So see, even when we assist the men, ladies, we're assisting ourselves, because when they're performing properly, hey, we can have smiles on our face as well, all right? So, this isn't just limited to men. This is for females too, because if our men ain't functioning properly, we got to have the secret weapon in the cupboard, Dr. Ruth Ann. So let's tell them about the secret weapon here on this call.
Definitely. Listen, we have something called Sankey Global. And, one thing I can tell you is that it is the only formulation on the planet that one can act on the inside cells of the mitochondria. And we are proud to say that. And it's a formulation that's been around now for 53 years and formulating in it constantly and developing constantly. And so to me, that says a lot, because, oftentimes companies will create a formula and be like, okay, we got it done. Well, not here at Sankey Global, because we have a partner out there in Japan called Sankey Mayor, which is a laboratory in bio nanotechnology, and they are constantly formulating it and making it better. We are now at a level where we're 25% stronger than we were before. So we are just making it better and better. When I first came on, we were at Orzot Enzyme 2. We are now at Orzot Enzyme 5. So that should tell you a lot about where we're going with our products. And this product helps to remove, like I always tell the guys, first of all, it's going to give you a light flush, a light detox. It's going to remove that excess mucus, excess inflammation out of your body. And why? Because we want to get down to that microcellular level where we can start having that circulation moving, pumping, blood flowing, so that when it's time for the pineal gland to erect, guess what? The blood is flowing. It's able to engouge with blood the way it is. You heard Nurse Adelie say, some of the men say, oh yeah, it goes up, but then, oh, guess what? It goes down, like too fast, too quick. Well, guess what? Having this spillage in your system, you're going to have that extension because the blood is flowing, as well as you're going to have longevity because the mitochondria is energized. It's been regenerated. you're going to have the stamina, you're going to have the energy to keep going, the blood is going to keep flowing, it's going to help decrease the stress. You heard her talk about stress at the last slide. It's going to help to decrease that stress, so then that doesn't even have to be the issue. And it's going to also help to assist with balancing out the gut. And then, of course, we have some other formulations. You heard her talk about hypertension and diabetes, where she speaks about know your numbers on other calls, and that would be our Crohn Fire. And then if you're suffering and you're one of those men that get up and go to the bathroom 100 times a day, but only a drop comes out, listen, you need to get on the Hasaki. You need that Hasaki to start cleansing and getting out all that backup stuff that's in the intestines, and feces that are in the intestines, in the colon, back up in the colon, so that that prostate can literally get some inflammation out of it. And then you heard her talk about testosterone levels. Listen, that Hasaki helps to turn down the testosterone levels, as well as literally it has over 596 metabolites. This has to do with your digestive processes to make sure that you're digesting your food the way it needs to. So those metabolites are a necessity, as well as balancing out your microbiome. We are 90% microbial, 10% human. Well, guess what? That Hasaki is going to feed that microbiome and make sure that it has the essentials that is needed, making sure to not feed the bad bacteria, but feed the good, so that you can feel healthier and live longer. So with that being said, that's 3 of our products. The inner 7 is for essential minerals that you can definitely mix in with the Balage. But we normally will say, especially for the Caribbean, because our men, 1, don't want to change their diets to begin with, and 2, it is our inner 7 has salt, sodium, magnesium, and potassium, about 40 to, I think it's 40 or 60 milligrams. I can't remember off the top of my head right now, of sodium. We recommend that start with the Balage, get everything circulating and percolating the way it should. And then we can incorporate that inner 7 about 2.5 weeks to 3 weeks in to taking the Balage, because then the blood is flowing the way it needs to. Everything is starting to percolate, making sure it's doing what it needs to do. So with that being said, Nurse Adley, anything else?
No, not really. But just to state this. Next week, I wasn't. You remember I told you I was gonna have the call every other week, but I want persons on this line to actually, and see, people are just coming in late, because I have to go. I have to go, but people are just coming in, but I have to go. But persons, this call has been a serious one, and I would like to ask you next week Friday. As I told Dr. Ruth Ann, I'm going to start doing these calls on time. I'm not going to be waiting around for others to come on, because we have guests who come on early, and we don't want to keep them, held up, because we had guests on this call early, before 9. And so we don't want to do that. So we want to just keep this going. And next week, Friday, I'm going to repeat what I did today. I'm probably add 1 or 2 more onto it, ladies and gentlemen. So get persons on this call, because, as I spoke, Dr. Ruth Ann, about persons who have young males, and they don't even realize what's going on with these males. They see the genital is small, and they believe, okay, well, this one just have a short genital. That's not true. That child most likely has a hormonal issue. And so these calls are not just for the products. These calls are to educate the masses about their body and things that they should look out for. And prevention is always, in the medical world, especially in the nursing world, where I come from, prevention is always better than the cure. And if you have something that is all natural, that can assist, guess what? Why not use it? Because if it doesn't have any side effects on the body, and you could take it. The thing about it is, with these products, Dr. Ruthan, that you didn't mention, these products can be taken in addition to your medications. There are no contraindications. No contraindications mean that it would not interfere with the medications that you're on. And the thing about it is, this is nothing that I'm saying out of my mouth. This is something that I've seen. This is something that I've proven with my practice with persons who have hypertension, diabetes, erectile dysfunction, cancer, kidney disease, MS. These persons, the only thing that I've seen, the only side effect, let me tell you the only side effect, Dr. Ruzanne, they have been able to decrease the amount of medications that they're taking. Some of them have even been able, their daughters have even been able to take them off of medication. I am a proven person for that, because as I said, I had hypertension, and I had pregnancy-induced hypertension. And the thing about it is, after I had the child, the thing wouldn't go away. It's supposed to go away, but it wouldn't go away. And they had to put me on medication because it became worse. When I had that child, because it became worse, I was paralyzed. And so I had to take the medication. I had to take the doctor's, and I know what hypertension, anti-hypertension medication do. And so when I became aware of these products back in 2019, and I was able to actually even increase my life insurance so that I can expand my house, let me tell you something. These products, it changed my life. And now I'm off hypertension medications. And also I was able to increase my life insurance. I don't know how many of you on this line want to be able to be off medications or see your loved ones off medications or decrease the amount of medications that they're on, because Big Pharma will tell you, yes, we treat this and we treat that. But the thing about it is it correcting some stuff? Because see, with these products, especially the Balage, what happens is, and I'm going to give you a short, Lord, I don't want to be late for my call. I can soon come off of here. What it does, see, as Ruthann was talking about, Frankie Mayor, that is the scientific company. What they did, the doctor, Dr. Beher Diaz, what he did, he actually went to live with the Okinawans to find out why they live so long, into their hundreds, 120, and they're out in the field. Why we can't do that? It's because of our gut. Our gut. And they go out in the fields and they exercise. They drink water. They're not exposed to all these soft drinks and foolishness and all the pollutions, the polluted air. Okay? So he wanted to know how he could take their gut and put it inside of us. And he did it by making these formulas, especially that Balage, because what he did, he used nanobiotechnology and made those particles, natural food, so tiny that it's able to go into the stomach and it's coated, and your enzymes do not break it down, because we notice that if we take other supplements, what happens is when we go to the restroom and we urinate, our urine is a different color, or it's high or offensive, or our fecal matter is hard or another color. So what he did, he actually coated it, and because he wanted to pass the gastrointestinal system. And when it did that, it actually was able to go into the bloodstream, and so tiny that it went into the cells. And when it goes into the cells, it jumpstarts the mitochondria. The mitochondria is the powerhouse of our cells. The mitochondria, and see, I ain't talking off the top of my head. I'm talking what is real. And y'all can look it up. The mitochondria attest for over 60% of our body weight. The mitochondria is the powerhouse. I'm talking just pure science. All right. And so when the mitochondria dies, what happens is our body dies, and it gives the body weight to diseases. So he wanted to jumpstart the mitochondria. And when you jumpstart the mitochondria and give the dying mitochondria life, what happens is we have new cells forming, new mitochondria. And what happens then is that your body goes into the process of what we call homeostasis. And homeostasis is the process by which God made for our body to start healing itself. So guess what? Your body is now healing itself. So when you take Big Pharma, what Big Pharma does is actually break down our cells. All right. It heals one thing, but breaks down the other. So why not with these medications that we're taking? If we could actually take something along with it, because we're not telling you not to take your medications, because guess what? Some of you are in a critical stage, you need it. You need it. And so if we could start now adding something to those medications for all that poison that's coming in your body to actually detoxify your body while you're taking those medications to avoid those side effects. And what happens is that you'll find that, hey, the doses that you're on is too high, and your doctor will have to start dropping your dose gradually. And you may be able to be drug-free. So that's all I have to say. And if you didn't get it, I don't know what it'll take for you to get it. So back to you, Dr. Ruthann. Is Dr. Ruthann still on the call? I guess she had, she sent me a message. She had an emergency. She had to drop off. Okay, guys, so thank you for coming on this call. And we'll be here again next Friday with the same call, but we'll have more added to it. And I may have on a guest speaker next week, Friday. So hint, hint, get your people on the line. I may have a guest speaker, a physician on the line next week to talk to us. So God bless you and have a good evening.
Thank you. Thank you.
You're welcome. You're welcome. Thank you. Man, y'all don't go home, eh? I gotta go to the next call.
Bye, Nurse Hanley. Bye.
Bye. Bye. See y'all next week.
Bye. Bye. It was good. It was good having you. We learned a lot.
Yes, ma'am. Thank you for coming.
God bless.
God bless. Hey, Marva. You're quiet. Love you.